Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart so that to minimize any potential infections. We are also screening our patients coming. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8 outreaches within the coastal region.
At this point, let me also remind you all, we have put in place teleconsultation services to ensure that our patients are able to access our services safely from the comfort of their homes.
The Aga Khan Hospital, Mombasa is happy to announce the opening of its state-of-the-art dental and implant center located on Buyuni Road opposite the YMCA. The dental and implant center is designed to provide an excellent ambience with clinics that are well away from the reception area as well as from each other, thus providing maximum cross-infection prevention, especially during this COVID pandemic environment. This facility is designed to provide the most comprehensive dental service to our esteemed clients, from basic diagnostic services to the most advanced cosmetic, prosthodontic, and surgical procedures. Our dental specialists, general dental practitioners, and dental assistants are trained to provide absolute safe dental treatment using the most up-to-date personal protective equipment and additional oral aerosol suction units with HEPA filters to minimize the spread of the COVID virus. This is keeping in line with international and Kenyan recommendations from medical and dental associations. Our goal is to provide safe, compassionate, affordable and quality dental care in a friendly, modern environment. Our patients can expect a personal caring attitude, a supportive team approach with an accessible and efficient service through modern techniques achieved through continuous professional development of all our dentists and staff. We look forward to receiving our clients for all their dental requirements.
Good morning, our audience. Today we are very lucky to have with us two very fantastic individuals with us, and we're here to discuss about weight loss. I want to give this opportunity to them to basically introduce themselves and tell us what we're here about. Over to you, Dr. Please just give us a very brief introduction about yourself.
Good morning, everybody. Welcome to our Facebook Live session on the Bariatric talk. My name is Dr. Abdi. I'm a surgeon, a laparoscopic surgeon, and I also do bariatric surgery, which is weight loss surgery. And today we are going to talk about weight loss. And I'll let Dr. Philip introduce himself.
Good morning. My name is Lundu. I'm a clinical nutritionist, resident at Abdi Hakin Mohamed, Mombasa. And today we are going to give you a brief of bariatric surgery, diet management, pre and post-operative, and lifelong nutrition management after bariatric surgery. We hope that most of you are going to benefit, especially for those who have tried, who have got high, lose weight, do diet, and think what is
Thank you. To our audience, Philip is normally louder than that. We know he was not feeling well recently, and we are very lucky to have him with us. An interesting question was asked, Dr. Abdi, by one of our participants. What are your hobbies?
Oh. I always get this question all the time.
Yes.
Well, I try to work out. For me, as you can see, I'm trying to be as fit as possible. So I do cycling. I do play some golf as well. But my passion is mostly cycling. I read a lot of books, listen to a lot of books. And I think those are the most the ones that I really like doing every day.
Okay. So to our audience, please, when you see Dr. Abdi cycling around, don't ask for a free consultation. So, over to the topic of the day. Dr. Abdi, what are we talking about today? Please, over to you.
So, Anthony, thank you for organizing this. This is a very important forum. We are going to talk about a pandemic. And that's not the COVID-19 pandemic. It's a pandemic. It's something which is all over the world. It's a global pandemic, which has unfortunately been neglected for a very long time. And that is the obesity pandemic. And we know that there are a lot of people out there who are struggling with weight loss, are challenged with their weight, but they have not been able to lose weight. They have tried many things, exercise, diet, behavioral modification, even medication, drugs, everything, supplements, but they have not been able to. And this is a worldwide problem. So we here at Abdi Hakin Hospital have recently introduced bariatric surgery, which is essentially a surgery for weight loss. And we wanted to talk about our weight loss program. We have a clinical nutritionist here. We have a team of individuals who deal with weight loss. And that is what we will be talking about today. And my focus as a surgeon will be mostly on bariatric surgery, which is weight loss surgery.
Thank you, Dr. Abdi. Philip, very briefly, what is your talk about today, very briefly?
Okay, thank you, Anthony. So my talk today, we are going to discuss about the lifestyle changes before bariatric surgery and after bariatric surgery. Basically, we're going to look at the impact of obesity, which has been mostly linked to type 2 diabetes, cardiovascular diseases. We are going to look at the transition of diet after bariatric surgery. Immediately after the surgery, what are you expected to take? we have different phases that we are going to break them down, and expectation and specific nutrients that you are supposed to take in this period. Also, we're going to discuss about the lifelong management back there at home. Also, we have a support program. We don't just do the bariatric surgery and then we let you go. We have to keep on following it up with you, some education and counseling here and there until that you have achieved your desired weight goal. Thank you.
All right. Thank you for that brief introduction. Doc, I believe I'm passing the microphone over to you.
Thank you. So my talk is basically going to just discuss generally what obesity is all about. And then I will delve into the management, mostly surgical management of obesity. The reason why I say surgical management of obesity is that over time, all over the world, people have tried many ways to treat obesity. But the only way that is a long-lasting, sustainable weight loss is by undergoing obesity surgery. So I will talk about that. But before I delve into that, I just wanted to talk about obesity. And in my introduction, I mentioned that this is a pandemic. And many people didn't know what a pandemic was before COVID-19. But basically, a pandemic is a disease that is found in almost every country in the world. And obesity, for a long time, was considered as just a normal thing. And as you know, in the African culture, if you're obese, you're more prosperous, you're wealthier, and you're somebody who is respected in society. That's how they've always been. But we've realized now that it is not just a condition, it's a disease. In fact, the World Health Organization has dubbed obesity a disease. And the reason why it's a disease is that people who have obesity or people who are overweight are at extremely high risk of all the chronic conditions that you know. Starting from the heart attacks, people who are obese are at almost 3 times higher risk of getting a heart attack than people who are not obese. People who are obese are at very high risk of getting a stroke. People who are obese are at high risk of getting cancers in women, mostly breast cancer, endometrial cancer, in men, prostate cancer. People who are obese are at high risk of getting type 2 diabetes, which has also many problems in the body. People who are obese are at high risk of getting difficulties with breathing. There's something called obstructive sleep apnea syndrome, whereby people are not able to sleep well at night and they're tired the whole day. And that is a respiratory problem. They're at risk of getting asthma. And as you've seen recently, people who are obese are at a higher risk of death from COVID-19. In fact, in Western studies, the countries which have the highest level of deaths from COVID-19 are the countries which have a high level of obesity. We in Africa haven't had such kind of hit from COVID-19 because probably I would say we don't have as many obese people or many people who have comorbidities like in the Western world. But we do have obese patients, obese people. And when we talk about obesity, it's not that when somebody says obesity, it looks like it's a negative thing to say, but it's not. It's a disease. It's a problem that has to be sorted out because any person who has obesity will have lifelong problems, chronic illnesses, even including kidney diseases. People end up having musculoskeletal problems, osteoarthritis in their joints. There are a lot of problems associated with obesity. In fact, in a study done in Sweden, they found that the people who are obese for a long time in their lives, their lifespan, especially in males, reduces by almost 20 years. So if you look at the general population and compare the obese population and the general population, the lifespan of the general population in Sweden is about 80 years old. But the lifespan for obese individuals who have remained obese throughout their lives is as low as 61 years old. So you can imagine almost 20 years. And the reason why that lifespan is low is because of all these chronic illnesses that are associated with obesity. Now, obesity is not rare. We have done studies here in this country, in Kenya, If you look at the streets, you walk the streets of Kenya today, you will see people who are overweight, people who are struggling with weight, and even if they are coming from the poor socioeconomic, low socioeconomic society, it doesn't mean that since we are a poor country that we don't have obesity. And there's one study which was done to show that almost 30% of Kenyan women have overweight, have issues with overweight. Right? That is a significant. So 1 in 3 women, even in the rural areas, have issues with weight. And first of all, I'd like to categorize the difference between overweight and obese. So how we usually measure obesity is by looking at the person's weight, right, and the height. That is called the body mass index, the BMI. So we make a calculation depending on your weight and your height. You could be a very tall person and have 120 kilos. Right? So that is may not even be obese because your height, your weight is because of your height. Right? You could be a very short person, right, and be 100 kilos. Then that's obesity. Right? So when we calculate the body mass index using the weight and the height, we look at an average. And if your body mass index is above 25, between 25 and 30, it's called overweight. And this is a very simple calculation that anybody can do. And if you are above 30, between 30 and 40, you're called obese. If you're above 40 and 50, you're called morbidly obese. If you're above 50, it's called super obese, which is now very, very serious situation. Even morbid obesity is a very serious situation. So we see people who are overweight, a lot of people who are overweight. And over time, it just takes a few more months, they can push themselves to go into the obese category, of having a BMI of 30 and above. So the way to treat this disease or this condition is by mainly exercise, diet, and behavioral modifications, which Philip is going to talk about. And this, unfortunately, is not very easy to do. If somebody has a BMI of 40, right, let's say he is probably 90 kilos, 100 kilos, and his height is 1.5 meters. That person is definitely, obese or even morbidly obese. And I know many people have tried it, tried exercise, tried weight loss, the diets, tried all types of supplements, and it's not worked. Then especially if you have associated diseases with obesity, like diabetes, high cholesterol, hypertension, central nervous system problems, then you probably will be the best candidate for obesity surgery. And when somebody hears of obesity surgery, there's always a fear of undergoing any operation, undergoing surgery. But it has been shown time and time again that it is the only way that you can have a sustained weight loss. Because if you go to an exercise program or a diet program, you will lose weight initially. Right? Some people lose up to 15, 20 kilograms. But within a year or so, they start gaining their weight back. Because it's all about behavior. It's very difficult to modify the behaviors of individuals. And we all love food, right? Especially we have KFC, all Domino's, pizza everywhere. It's, even if you lose weight over time, you end up cheating. And then you gain your weight back. But if you undergo bariatric surgery, which is surgery for weight loss, the chances of cheating are very low. Because this surgery ensures that you won't be able to cheat. Because what we do in bariatric surgery, weight loss surgery, is we reduce the size of the stomach. And even if you wanted to eat a lot, you may not be able to. Because your body just can't take it, your stomach just can't take it. And so whether you like it or not, you will lose weight. And there are different ways to do this bariatric surgery. The most, one of the easiest ways for people who are not really interested in an operation as such is to do something called an endoscopic balloon. This is a balloon that we put in the stomach. We don't do any surgery, we don't cut anything. We take a camera, the endoscope, the one that we use to check for ulcers in the stomach, and we put a balloon inside the stomach, fill it up with half a liter of fluid. And your stomach has a certain capacity. So if you eat and that balloon is there, you would feel, you can't eat anything, right? Because it's like your stomach is already full with this balloon, with fluid balloon. And this is a temporary way that we use for patients who are not interested in an operation per se. And after 6 months or so, we can remove the balloon and you can go back to your life. The problem with this is that many people will end up regaining their weight again, right? Because it's behavioral issue, right? So if, let's say for 6 months you have not been able to eat well because of the fact that you can't eat much, and then after 6 months you remove the balloon, there's always a tendency to relapse and start eating how you used to eat before. And most people end up gaining weight again. That is a problem. So we usually use the balloon, the endoscopic balloon, for patients who are obese, super obese, morbidly obese, who cannot undergo an operation for one reason or another. Maybe their heart is not strong enough, they have had a stroke, or they have illnesses that are preventing us as surgeons to operate on them. So we use this as an opportunity for them to lose weight. When they lose weight, it allows them to recover from this illness much faster. Like if you have a heart problem because of obesity, if you lose weight, you're definitely going to get better. And it has been shown time and time again, patients who have undergone bariatric surgery who are diabetic and hypertensive, many of them end up reversing their disease. You stop taking anti-diabetic medication. You stop taking hypertensive medication. Why? Because your body doesn't need them anymore because you've lost weight. So the bariatric surgery is the only way to reverse these conditions. In fact, now we don't even call it bariatric surgery anymore. We call it metabolic surgery. It's a medical term. We are using it now not only for weight loss, but for reversing diabetes. So for a obese person who has a BMI of 40 or even 35 and is diabetic, if you do bariatric surgery, there's a very high chance that that patient's diabetes will be reversed. It's the only thing that can cure diabetes. There's nothing else in this world that can cure diabetes. Same thing for high blood pressure. Same thing for liver diseases. People who are obese usually get something called fatty liver disease, whereby the liver becomes full of fat. And that can lead to something called non-alcoholic steatohepatitis. It's damage to the liver because of the fat, which is because of inflammation in the liver. And that can further lead to liver cirrhosis, can even lead to liver failure. People end up having liver transplant, all because of the fat in the liver. But if you do bariatric surgery, you can reverse the effects of this fatty liver and prevent it from progressing to becoming worse. So that is the advantages of doing bariatric surgery. So now, what is bariatric surgery? The one that I'm going to talk about today. I've talked about the endoscopic balloon, which is considered as a minor bariatric surgery, but it's not really a surgery. I'm going to talk about the most commonly done procedure all over the world. It's called sleeve restrictomy. This is basically what we do is we take out part of the stomach, about 2/3 of the stomach comes out. And nowadays we don't do this often operation. Nowadays everything is done with minimally invasive surgery. We use a camera, tiny camera, make tiny holes in the abdomen, and go in there and take out part of the stomach. What it does is it reduces the size of the stomach and restricts you from eating more. So even if you eat, you fill up very fast. So you can't overeat. And definitely you'll lose weight. And the other advantage of doing that, the part of the stomach we take is not just any stomach. There's a hormone from that part of the stomach called ghrelin. You don't need to know about the name of the hormone. This hormone is a special hormone secreted by that part of the stomach that affects your brain and makes you eat more. So if we cut that part of the stomach where that hormone is located, where that hormone is being secreted from, even the urge to eat reduces. So you have a reduced urge to eat, and you fill up very fast. And this way, you don't, you lose your weight very, very quickly. And the surgery is such a minimally invasive surgery, whereby patients can come in on the day of the surgery and be discharged the next day. In centers where they have bariatric programs that we are trying to develop, these patients can even be done on the day. That means you come in the morning, get your surgery, and then go home the same day. We haven't reached there yet, but we are looking at procedures whereby, a program whereby we can be able to operate on you and discharge you home the next day, because this is a minimally invasive surgery. It's not a big operation. You don't cut your stomach, up the abdomen, you don't open anything big. You just go in with the camera and do everything through the camera. And the recovery is extremely fast. In fact, you can resume your work the next week after the operation. We've seen that in some of the patients. So that is the most commonly done surgery. The second commonly done operation is something called gastric bypass. So you might have heard of this. I'm sure for the audience who are listening to this, they probably have interest in weight loss surgery. You Google, if you go online, you will hear about it a lot. Gastric bypass. What gastric bypass does, this is a bit more complex than the sleeve gastrectomy, the one for cutting the part of the stomach. It is, you cut part of the stomach, but you also do something called a bypass. So it is a bit higher level operation. It's a bit more complicated. You end up being in hospital a bit longer, and we cut some parts of the intestine and join some parts of the intestine. And this is basically what we're doing. We're bypassing large part of the intestine. So remember, the intestines are very, very long. If you've seen an animal that's being slaughtered or something, you see all this, lot of intestines. The intestines can be up to 4 meters long. So if you have 4 meters, the reason why they are 4 meters long is to allow food to be absorbed. So the food you eat is digested in the stomach, it's digested in the upper part of the intestine, and then it goes through all the intestine to be absorbed by the body. And that is what now goes into your body and causes fat deposits and causes obesity. So what we do is we bypass almost about 2 meters of the intestine, almost half of the intestine are bypassed. So you can imagine if you have a river flowing upwards and flowing downwards. Instead of going through the river, we just create a channel so that the water doesn't flow up and come down. It just goes across. So it bypasses the rest of the river. And that's the same thing that the nutrients do. Food that you eat when they digest when you have a gastric bypass. So you have 2 in 1. You have the reduction in the size of the stomach, and you have a bypass of the intestines. And by doing that, you are reducing, first of all, you are removing that part of the stomach which produces the hormone, the ghrelin. Remember I say that causes you to affect your brain and makes you want to eat more. It also reduces the size of the stomach, so you can't eat a lot. And thirdly, it also reduces the absorption of food because it reduces the surface area through which the intestines can absorb food. And it is a much more effective procedure for patients who are super obese, people who have a BMI of 50 and above, or even for BMI of 40. And gastric bypass has been shown for studies whereby people undergo gastric bypass, they lose weight, almost about 70% of their excess weight loss within 18 months. So if let's say you are supposed to be, according to the BMI, you're supposed to be 80 kilos, and you're actually 140. So your excess body weight is about 60 kilos. So you should be able to lose 70% of that in the next 18 months. That is a significant weight loss. And it also maintains weight loss for a very long time, up to 5 years, and probably even forever. That is the advantage of doing gastric bypass. It's a bit more complicated operation. You spend a bit longer time in the hospital. It's a bit more expensive because you do a lot more surgery on you. But it's all done minimally invasive, just like the sleeve gastrectomy. We use camera. We don't cut. We don't make cuts in the pelvis. We use the camera, go around and do everything using the camera. Those are the 2 main surgeries. There are many other surgeries that you might come across when you go online, but they're not important because they are not something which are commonly done, and there are specific reasons why those surgeries are done that we want to discussion. So I will end there in terms of bariatric operations, and I will welcome any questions, and we can continue the discussion.
Philip, tell us about weight loss for matters nutrition.
Okay, we have received so much details about bariatric surgery. So Dr. Abdi has defined for us what obesity target is BMI 40 and above, and we see that we get our BMI by calculating our weight by our height in meters square, then we get our BMI. Apart from BMI, there are other nutritional screenings also, which is very important that we're supposed to know, even as we prepare for that bariatric surgery. The other people have high levels of visceral fats, the other people have high levels of body fats. And this is important to do the nutritional screening or assessment before you start the bariatric surgery and after the bariatric surgery, so that you come up with an individualized and personalized diet intervention. Now, most people have, for quite a while, those people who desire, they have seen the impact of obesity, especially during this COVID-19. Most of the people have been affected. Large percentage that those people are obese, people who have high blood pressure, and those who have high diabetes. And it's not that people have not tried. There are those people who really desire to lose weight. They have tried all types of diet, from keto diet, they have gone to intermittent fasting, they have done the General Motors diet plan. And those who also come and ask their Tari if there is any pill that they can swallow, one tablet they can swallow and reduce their weight. It shows that they have that burning desire to change their weight, but they are struggling. This is an important opportunity where you can come in, especially those who have been struggling to lose weight, those who have done the T diet plan, those who have been taking eggs diet plan. You take eggs from Monday to Sunday, but there's no much weight changes in your lifestyle, and you are struggling to understand what is happening, and you want to improve your health because of the associated risk factors of obesity. And as we plan for this bariatric surgery, as the way the doctor has informed us, that it's a program. It's not that it's one-off thing that you come, we do the procedure, then we let you go. This is something that we have to do the screening before we say that you are okay, you are fit for this surgery. We have to assess you, we check your height, weight, we have to check your diet history, your goals in life, particularly to your health, before you do that surgery. The other people who might desire to be, and according to our assessment, we feel that you can try that probably for 1 week, or you can try that for 12 weeks, and if there's not any sign of improvement in terms of compliance or weight changes, we might reconsider your proposal for the bariatric surgery. Now, as we do the bariatric surgery, there is that transitional period. You cannot come out of the bariatric surgery and you go back to the normal diet per se. As the doctor said, that even we can have a daycare process, daycare procedure, and then we release you. There are certain stages, certain phases of diet that you have to pick them gradually as we go to what we call long life nutritional management. After the procedure, post-operation, post-bariatric surgery procedure, there are certain specific diet that you have to follow. And we do understand, as we have been explained, that there are certain part of the stomach that will be removed, and certain part of the intestinal resectioning that will be shortened. And we understand that there are certain vitamins, certain minerals, depending according to our body system. There are certain sections that this specific nutrient will be absorbed. This specific nutrients will go to this particular region to be absorbed. And if that part is being removed, what are we going to compensate with? So we look into nutritional supplementation, the vitamins, the minerals. As we plan for the vitamins and the minerals that you're supposed to take, we don't go just by a day off thing that go today, take this pill, take this supplement. We have to discuss the grams of protein that you are supposed to take during the first phase, the grams of protein that you're supposed to take during the second, the third, and the fifth phase, where we put you to lifelong nutritional management follow-up. And then we discuss about during the first phase, after the bariatric surgery, what are you supposed to take for breakfast? The gram of calories that you're supposed to take for breakfast. I know most people who have been trying to lose weight, they have been calculating their meals. They want to know the calories they're supposed to take. But for this one, it will be much more easier because we are assured that your weight will reduce. Now, we have to make sure that you maintain this weight loss, that we don't experience any relapse after 3 months or after 6 months. Now, when you talk about the first phase, we look at the types of the diet that you're supposed to take, like the clear fluid diet. This clear fluid diet, is it balanced? Is it accessible to your region? And how long are you going to take in the preparation method? Then we move from the clear liquid diet, we go to the full liquid diet, according to a nutritional assessment and the progress of your healing. Now, those who can go on the first clear liquid diet, phase 1 for 2 weeks, there are those who can go for 3 weeks, there are those who can go even for 3 days, and they are able to tolerate the full liquid diet. So basically, the progress of each and every individual we have to monitor, because we'll have your details, your history, and the medication that you'll be in. It will be easier for us to do a proper follow-up and to ensure that you maintain this weight loss. So after moving from the clear liquid diet to full liquid diet, we move to what we call adaptive diet or purine diet. This diet is it's like a gap between the liquid diet to normal diet. But in this process also, again, we see at the preparation method of that meat, we see at the portion and the calorie and the vitamins, the minerals that you're supposed to take, how many grams of carbohydrate that you're supposed to take during adaptive phase, how many grams of protein that you are supposed to take in that adaptive phase. Now, depending on the type of bariatric surgery that you have done, is it the ballooning? Is it the part of the stomach that have been removed? Is it part of the intestine that have been removed? So with that knowledge, which part that you went through the bariatric surgery, we are able to know the specific nutrients that you are supposed to target because of the areas where they're supposed to be absorbed in the body system. In particular, nutrients which are supposed to be absorbed by the stomach, and we know that part has been removed, we are in a proper position to know the recommended daily allowance that we can supplement instead of having a blanket supplementation. So we give a specific supplementation of the vitamins and the minerals, and sometimes even the proteins. Now, to caution on the muscle loss, there's a formula for calculating proteins for every phase: phase 1, phase 2 of the diet, phase 3 of the diet, phase 4, and then the phase 5, the lifelong nutritional management. So we have the clear, phase 1, the clear liquid diet, phase 2, the full liquid diet, phase 3, the purine diet, phase 4, the adaptive diet, and phase 5, the lifelong nutritional management. This is most important. This is behavioral change. Doesn't mean that when you have done the bariatric surgery that there is a free will that because the size of your stomach has been reduced, now you can go back to junk food. So now this one will focus mainly on our program on the behavioral change. What are you supposed to take? And then in the behavioral change, we will bring in the physiotherapists who will help us in the exercise routine. How many minutes, which type of exercise, incorporating with the diet that you are taking, how much calorie are you burning, so that when we do the clinical visits, that we are able to see your progress step by step. We don't want such a scenario that you have done the bariatric surgery, that after a year or after 2 years, we find you also again that you are obese, or you are even more obese than before you started the bariatric surgery. So when we do the lifelong nutritional management, we have to do things step by step. It's a program that runs after 3 weeks. We assess you. We do a follow-up. It can be a phone call follow-up. It can be Zoom, online nutritional follow-up. It can be actual follow-up that you come to the institution. That we set goals as an individual. Where are you coming from? Is this meal available where you're coming from? Are you able to prepare this meal? Is the meal able to sustain you? Is the meal able to make you enjoy that meal? We move from the boring meal plans that we understand that is in the Google, that we keep on downloading, and yet we keep on failing. That we want you to enjoy the normal diet as you progress and you enjoy that meal, so that we don't go back to where you were before. Now, as we discuss about the lifelong nutritional management, the behavioral change, we set short-term goals and long-term goals. The short-term goals, we have to see that maybe probably after 12 weeks or after 8 weeks, and the long-term goals, depending on your availability, that we can go even for a year, that we set it each and every time that you come for a visit. This will help us that we make sure that your desired weight goal that you have been looking for, and the prevention of metabolic syndrome that you have achieved in life. And this requires that we have to sit down one-on-one. We come up with a plan. Most of the time, we tend to include the family members for psychosocial support. And then, how are you going to take your meals now after the surgery? What happens now when you go for a conference? What happens when you travel? What happens when you have a workshop? What happens when you have a religious festival, or you are going for fasting because of religious aspect? Now we come and we sit and we discuss in every step that you're going to go through this phase of bariatric surgery. Apart from the calories that you are going to look and adjusting your meal plan, you're also going to look at the normal lifestyle. What will you do now after the bariatric surgery? Are you supposed to go to work at which particular time? Which type of exercise is okay for you as we sit down with the physiotherapist? And the most important thing now, it is the snacking. Now, when you go shopping, are you in a position to do the right shopping? To do the grocery? What are you supposed to get? As we bear in our mind that there is a surgery that has been done, and you have to follow a proper meal plan. So for the meal plan, most of the people, they tend to request that the meal plan should reflect the entire family members, to cut the cost so that they don't cook twice or thrice in the family members because of their condition. Sometimes you look at the mental health. You know, when people prepare meal in the family, they say, as you prepare food, remember so and so, he doesn't have a stomach, make sure you separate his meal. And we really need to bring in the family members to support you, even during our session, that they understand the kind of meal that they are supposed to take. You know, when we change and there's that transition of diet plan, it will be an exercise of futility that the same junk food that you have been taking that brought you to that super obese is still available in the family, and sometimes people take in the family. How are you going to make sure that you have changed your lifestyle in terms of the diet, in terms of the exercise routine? And your partner or the family members will play a key role in ensuring that during your recovery phase, in your lifelong nutritional management, they are part of it. They are not part of those people who will tend to and tell you that since you have reduced your stomach and your intestine, you are supposed to take everything and anything that is available. So we'll come up with a program that involves the entire family members or your partner, and we take with every individual, even as family setup, we come up with short-term goals and long-term goals to understand. Are you supposed to go back and take chapati? Is it okay for you to go and take biryani? Is it okay for you to go and take all kinds of soda in the market? And which supplements are you supposed to take, and for how long? There are certain supplements in the market right now. There are herbal supplements, there are pharmaconutrition supplements, and we discuss each and every supplement in each and every phase. This is not something that you come today, we sit down and tell you, you'll be taking this for this period, after 5 years you come back. This is a program, that it's a process that we have to take you step by step as we do that follow-up and as we make the meal plan. So in our meal plan, we'll incorporate the breakfast, the lunch, and the dinner, and also the snack in between, if it's okay. And sometimes we discuss how you're going to manage the snacking, especially when you resume back to work. Most of our working places, it's either tea with mahamri, tea with mandazi. So we'll come up with a program specifically. What is your breakfast that you're going to take in this particular period? The next 3 weeks, this is your breakfast. The next 3 weeks, this is your lunch. This is your dinner. This is your snacking. Also, we will come up with a menu. By chance, you go to dine outside, you attend any meeting, whatever meal that is prepared there, are you in a position to request what you have been trained? You know, this is a habit that a positive habit that you're trying to create. That even maybe after the program, after 2 years out of the program, 3 years out of the program, you are able to stand alone and you are able to say, me, I'm going to eat this. Doesn't matter where I am, because you understand your health status very well. And we'll discuss even the effect of each and every type of food, the starch, because we have 2 different types of starch. We have the simple carbohydrate, we have the complex carbohydrate. We discuss about the proteins, because we have the animal proteins and the plant proteins. Also, those people who are vegetarian after the bariatric surgery, which type of vegetarian diet plan that is suitable for you. We have to factor in most of the things, the religion. You have to factor in your working status, the nature of your work, your age, every meal plan, every objective that you are going to set, either short-term and long-term. We expect for you to be in this program for quite a while. It's not something that is a one-off thing, because we want to have the best result, and our objective is that we either prevent and manage chronic diseases like diabetes and hypertension. Thank you.
Thank you, Philip. for that interesting session. To our audience, I can guarantee you that Philip is normally very loud. Today, he's a bit low because he's not been feeling well. So we wish him quick recovery, and he looks like he's fully recovered. So we are now going to the question and answer session. We'd like to encourage our audience to ask as many questions as possible so that the doctors can answer them during the session. For now, we will take a very short break to allow them to sip some water, and then we'll immediately begin the question and answer session.
Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji, and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart so that to minimize any potential infections. We are also screening our patients coming. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8 outreaches within the coastal region.
At this point, let me also remind you all, we have put in place teleconsultation services to ensure that our patients are able to access our services safely from the comfort of their homes.
So we are back to the question and answer session. And we encourage people to ask as many questions as possible so that the good doctors can answer them during the session. Philip, I think you've already answered this question that was asked by Amy. How do you measure body mass index? But maybe you can just briefly explain again how you measure body mass index.
It's taking your height divided by your weight divided by your height in meters squared. Then the normal BMI is between above 18.5 to 24.9. Overweight is 25 to 29.9. Base class 1 is 30 to 35. Then score base start from 36 and above.
Thank you. Wangeshi has asked, does bariatric surgery help to resolve acid reflux permanently as well, other than the weight loss?
Yes, so one of the problems of obesity is acid reflux. What that means essentially is that you have acid in the stomach. Where the stomach has hydrochloric acid. Some of it can come up into your lung, into your esophagus, the food pipe, and that's called acid reflux. And the reason why it is much more prevalent in obese individuals is because of the weight. Obese people have a lot of fat, increased pressure in the abdomen, and they have a lot of acid reflux. So yes, bariatric surgery can reduce, especially if you undergo gastric bypass, it can actually eliminate acid reflux completely. That is the gastric bypass. If we do a steam gastrectomy, whereby we just cut out of the stomach, there's always a small chance, about 30% chance that the acid reflux will still remain. So for people who have acid reflux and who are obese, the ideal surgery for them would be a gastric bypass, and the acid reflux will go away completely.
So to add on what I said, that apart from the bariatric surgery, even during the diet management, you have to get the history. That if you have history of acid reflux, during the follow-up program, the lifelong follow-up program, we'll address certain food that might also trigger the acid reflux, and we put you a proper diet that will maintain your weight, also prevent also the onset of acid reflux. So this is something that is not only about that particular problem that you have, also we tend to prevent that problem from reoccurring again. Also, we talk about behavioral change. What are the behavioral change when you eat a meal? What are you supposed to do? Some people tend to eat meal and then they go lie down. You also plan how the timings of your meal and then the types of food that you're supposed to take. There are certain meals also, even after bariatric surgery, there are certain meals that you cannot take and then you go and lie down immediately.
Thank you, Philip. Alex has asked, which is the most effective weight loss, especially the abdominal loss, other than the surgery?
So the question I think you're asking is that abdominal weight loss. So very good question, very good question, because it has been shown that people who have abdominal obesity, right? Obesity can be separated in different ways, and especially in males, most of the obesity tends to be within the abdomen, and that is fat that is accumulated around the organs. We call it visceral fat, like fat in the liver, fat around the intestines, fat in the stomach, or you can have obesity because of the belly fat, like the beer belly, for example. And this one is the one that is actually very dangerous, and it's been associated with heart disease, diabetes, and all the bad things that obesity brings. Mostly happens in people who have obesity that is around the abdomen. And the waist circumference is a way that we use to determine the level of your abdominal obesity. So the question you're asking, I think, is there a way we can get rid of that fat alone? Yes, you can do plastic surgical procedures to remove the fat, but it doesn't get rid of the visceral fat, which is inside the abdomen. So the only way, the best way, is to undergo bariatric surgery. And what bariatric surgery does is that we don't operate on the fat, we don't remove the fat. That's not the aim of the surgery, because that's a temporary problem. The fat will always come back. What we do in bariatric surgery is that it's an indirect way whereby we reduce the size of your stomach so that you don't eat a lot, and because of your reduction in food intake, you will undergo through a very rigorous program, as Philip has already explained, and with a proper program, you will lose that fat automatically, it will disappear. So you really don't need it to be removed. There are people who undergo something called liposuction to remove the fat from the abdomen. It is a cosmetic procedure. It's not a bariatric procedure. It's only useful when somebody wants to look good, but it doesn't treat the problem. It doesn't prevent you from getting heart disease or diabetes or hypertension or strokes. It doesn't, because it is just something we're removing. We're not getting to the bottom of the problem. So bariatric surgery gets to the bottom of the problem and deals with the underlying problem.
Thank you, doctor. Someone has asked, will the good doctor please explain to us what are the risks involved with this procedure? We'll appreciate a detailed rundown of all the risks and complications before I choose to pursue this treatment.
It's a very good question. We get that question all the time when we see patients who are ready for surgery. Like any surgical procedure, there's always a risk. It's not 100% that you will not get a complication, you won't get adverse effects. Although the risks are very, very low, very minimal. So it depends on the procedure. If it is a sleeve gastrectomy, which is cutting part of the stomach using the minimally invasive surgery, the risks are quite low. The thing is, what we do is we cut part of the stomach and we use something called a stapler to close that part of the stomach which has been left behind. And one of the biggest worries for us surgeons is if there's a leakage from that part. If you have a leak from where we cut. And although we know that as doctors we are able to identify that immediately within a day or so, and we have to do another operation. Luckily, we haven't had to do that so far. It's very rare. It can happen maybe like 2 in 100 people. So, and that is the biggest worry. The second biggest worry, risk of an operation like that, is bleeding. So when we do that cutting, we're also cutting through some of the blood vessels that are supplying the stomach. And sometimes the blood vessels, they might still there, and after surgery they start bleeding. And then we have to go back again and clots and control the bleeding. Also very rare. Right? So it happens maybe 5 out of 100 people. So as you can see, 90 to 95% of the time, no major risks with this surgery. And that's why it is the most commonly done operation. The gastric bypass surgery has slightly high risks because it's a bit more complex operation. Apart from the fact that we cut the stomach, half of it, we also join part of the intestine. When we do the bypass, we take part of the intestine and join some others, and we bypass a bit of the intestine. So you have 2 places where you cut it, and there's a place where you join it. So there's a risk of that place where we join it. We call it an anastomotic leak. Again, rare, right? It happens over 5% of the time. There is a risk. Part of the cover
And the good thing about these things is that they are able to be picked up early, and as doctors or surgeons, we are able to find them out as soon as possible and sort them out as soon as possible. So they are not things that we can, we can just, we rarely have issues where a patient lost his life after a bariatric procedure. It's less than 0.01% chance of dying from bariatric procedure, especially in a place where it's well done, high level of experience, good team like we have here at Aga Khan. So those are some of the risks. And then of course there are other risks. Remember, these patients, obese people, many of them have comorbidities. They have diabetes, hypertension, heart disease and all that because of the obesity. So there could be risks associated with that, because when you undergo surgery, it has to be done under anesthesia. And if you undergo anesthesia and you have a heart disease, you can develop heart attack or you can develop a heart problem. But before we do any surgery, we always ensure that your heart is strong enough, your blood pressure is well controlled, we optimize you. Right? We need to get a physician on board. We need to make sure that everything is optimal before we do the operation. That's why we rarely have complications from anesthesia.
All right. So, Dr. Yasser has asked, how do you manage childhood obesity?
Yeah, good question, because obesity normally starts in childhood, most of the time, especially in families who have obese people within the family. And it's all about mostly genetic. So obesity itself is a multifactorial problem, right? It could be a genetic problem. There could be a family genetic predisposition within the family. It could be environmental. And you can find that in a family, what people eat is the same, right? So if the father and the mother are obese, most likely the children are obese, or they will be obese. It's because they eat the same food, right? If the father and mother eat junk food, the children will also eat junk food. And if obesity starts at a very young age, normally these people will end up growing to become obese in the future and have a very high risk of cardiovascular diseases, diabetes, and stroke, as you mentioned. So childhood obesity is a very difficult thing to deal with. But the management is mostly nutritional, and that's where we focus on. And behavioral modifications. We teach the children at a young age what to eat. Right? They need to have enough sleep. They need to make sure that they're not eating junk food. there has to be a program. They have to be in a program which allows them to do that. When they get to the adolescent period, if they are still obese and they failed the behavioral modification, the exercise, the program that has been laid out, and they get to the adolescence, then they can be candidates for bariatric surgery. We do not advocate for bariatric surgery in a child. We'll only do it once they reach adolescence and they've failed the programs that Philip had talked about.
Thank you, Doc. Someone has asked, what dietary changes would I need to make after bariatric surgery?
So let Philip answer that.
So the changes that we are going to make after bariatric surgery, we are checking on the consistency of meals, the preparation of meals, the texture of meals that you are going to take, the frequency of your meals intake, and the portion that you're going to take. So sometimes it's individualized, and we go as per what is available within your locality.
Thank you. Judith has asked, how quickly can I expect to start losing weight? And is the procedure reversible?
Okay, those are very good questions. So the first question is, how quickly can you expect to start losing weight? It's pretty fast, but it depends on many things. And the most important thing is your lifestyle, your modification of your lifestyle, your behavior. Right? Some people can have the stomach reduced, but they can go and drink 5 bottles of Coca-Cola a day. And as we know, Coca-Cola has a lot of sugar in it. So you're drinking liquid calories. That doesn't help because that sugar will be converted to fat in the body. So you may not lose weight as much as you want. So that's why you have a very good nutrition program with Philip and myself and the team that is involved, that we have to follow you up and make sure that you're having a sustained weight loss. But most people, I would say 99% of the people who undergo bariatric surgery, they are motivated people. By the time somebody is actually willing to undergo an operation, right? We have already screened that person, we have identified that this person is a candidate for surgery. They undergo a rigorous preoperative screening program, and we know that this person is motivated. If you're motivated and you're willing to lose weight and you undergo bariatric operation, you will lose within a few months, right? Within the first 6 months, you might lose maybe about 10, 15 kilos. By 18 months after surgery, if you have had a sleeve gastrectomy, you are expected to lose about 40 to 50% of your excess body weight. Like let's say you are, as I mentioned earlier, if your weight is your normal weight, ideal weight is 80 kilos, according to your height, you're supposed to be at 80 kilos normally, and you are 140, your excess body weight is about 60 kilos. So you have to find a way of losing that 60 kilos. So within 18 months, you probably have lost maybe half of it, right? And probably even more. Right? And the good thing is that most people, when they start losing weight, it is a sustained weight loss because they get the feeling. You know, when you lose weight, you sleep better, right? You have a better lifestyle, you dress well, you look good, right? You walk, you feel light when you're walking. You basically feel like you're on top of the moon, and that way you end up, becoming much more responsible, and most people end up getting down to where they need to be in their ideal body weight. So we're talking about a period of a year or so. The second question was reversible. So reversibility of bariatric surgery. So there are 2 operations that I've talked about: the sleeve gastrectomy, which is a surgery to remove part of the stomach, and the gastric bypass, which is to remove part of this. You don't remove part of the stomach; you cut part of the stomach, make the stomach small, and bypass the intestines. So these 2 surgeries, they're different. The sleeve gastrectomy, where we remove part of your stomach, is not reversible because we remove that part of the stomach. We can't put back another stomach. Right? So that is not reversible. But the gastric bypass is a reversible procedure. Let's say if you want a bariatric procedure that is reversible, we will recommend a gastric bypass because we don't remove the stomach when you're doing gastric bypass. All we do, we cut the stomach, separate the stomach, and take part of the intestines and bypass the rest of the intestine and stick it up onto the stomach. So when we're doing reversal, we just reverse everything backwards, and we allow you to go back to the way God created you. That's what you want. But the risk of that, of course, now is gaining weight again if you undergo reversal. But if it is gastric bypass, it is reversible.
Thank you, Doc.
Allow me to mention something. The question was about how long is supposed to lose weight.
Yes.
Remember, we said that it's a program. It's not something that it's a one-off thing, that it has to go with nutrition. That's why we call it a program, that we have to sit down and, first of all, during the assessment, we look at the underlying cause of your obesity. Was it lifestyle? Was it a sedentary lifestyle? So we deal, as we do the bariatric surgery, we deal with what brought you here. So during that program, we tend to discuss about the empty calories, where the doctor said that you can take 500 liters of soda. We look at the nutrient-dense food now. You have been taking this is your diet history. After this bariatric surgery, this is now what you're supposed to be taking. There are people who don't have this information and they found themselves that they're obese. Now this program will help us to solve the problem where you came from and help to, as you move forward, as you lose weight, this weight loss is sustainable. That's why I've said that it's a program that you have to do a follow-up. Apart from the bariatric surgery, to lose that weight within that 6-month period or one year period, there is a nutritional management follow-up. What are you supposed to take? How are you going to sustain this weight loss? There's no point of losing weight 30 kg within 6 months. Then you still go back to beer, 10 bottles of beer a day, 5 liters or 2 liters of soda, still go back to junk food. Bariatric surgery is not licensed to go back to junk food. It's about changing your behavior, improving your lifestyle. Thank you.
Thank you, Philip. Wangeshi has requested, will you kindly and briefly explain the balloon procedure again and what BMI level is recommended for this option?
So balloon is an endoscopic procedure. We use an endoscope. The camera that we usually use is a long tube with a camera at the end. We go through your stomach, your throat, all the way down to the stomach, and we look at your stomach. And we usually use that endoscope for diagnosing things like ulcers and all that. But in this situation, there's a specific balloon made for that. We put a balloon inside your stomach, we inflate it with fluid that stays, almost half a liter of fluid that stays within your stomach. And we don't cut anything, we don't do an operation, we don't do anything. It's just a camera that goes through your mouth and we remove it. And this is a day case procedure. You come in the morning, go home the same day. You don't have to be admitted. The thing about it is that after 6 months, we have to remove the balloon. You can't stay there forever because it can bring side effects, can cause complications within the stomach. And what it does is that it reduces your capacity to eat. So you end up having your stomach is full already all the time. So even if you go and want to eat a whole plate of biryani, you may not be able to eat because you can't eat it. It can't fit into your stomach, right? The balloon is already there, and you will lose weight. Yes. So there's no specific BMI category that we use for the balloon. What we usually do is that we discuss these things with the individuals. So when we meet you as clinicians, myself, Philip, Dr. Omar Ramadan, a colleague of mine, is also here. We have a psychologist who also be involved, physiotherapy. There's a team of people who will meet you, and we discuss options, and we look at your particular condition. If you have a very high BMI of 50, and let's say you are not a candidate for surgery because of the comorbidities that you have, the best thing is to put a balloon. By putting a balloon, you lose weight very quickly, and that helps reduce the comorbidities. And then you go for surgery. So it's mostly used as a bridge. But for those people who don't want surgery, balloon is an option. There are a lot of people who just want to try something else. But the problem with the balloon is that if you remove it after 6 months, there's a tendency to gain weight. Remember I said when we do a sleeve gastrectomy, when we are removing part of the stomach, there's a part of the stomach that produces a certain hormone called ghrelin that goes to your brain and makes you want to eat. So we remove that part of the stomach. So that's the advantage of the operation. Right? So, but the balloon doesn't do that. The balloon just fills the stomach. Just reduces the capacity.
Thank you, Doc. Sarah has asked, you've talked about physiotherapy. What type of physiotherapy program or process can one have before or after the surgery?
So there isn't really a specific physiotherapy process before surgery. What we do is we introduce you to the physiotherapy team because after the surgery you need to have a proper exercise program. So this is a program. This is something that involves everybody. And you will have an intensive exercise program that when people hear of exercise, they think of lifting weights and all that. That's not what exercise is all about. It's recommended that even if you walk 60 minutes a day, 1 hour a day, that is exercise by itself. Now, if you're obese, if you have a BMI of 150 and above, you may not be doing enough exercise because when you walk, you feel tired. You might have arthritis in your joints because of the heaviness of the weight that you have in your body. You may not really be able to do intensive exercise. That's when now physiotherapy comes in. They do a lot of exercises. They teach you simple exercises that you can do. Even we can do before surgery, but certainly it's important to do these exercises after the operation.
Thank you, Doc. Someone has asked, how long is the recovery process?
If it's a sleeve gastrectomy, within a week or so, you should have recovered. Right? You can get back to your normal life. Basically, normal life meaning you can go back to your work, you can go back to your whatever you've been doing. Right? If it is a gastric bypass, slightly longer, because you'll be in hospital a bit longer. Your discharge will be delayed a bit more because you have to observe. It's a bit more complicated operation. And maybe about 3-4 weeks later, you may be able to resume your normal activities, your normal work.
Someone has asked, will weight loss surgery affect my ability to become pregnant?
No. So actually, for people who are obese, there are some side effects of obesity on the reproductive system. And many women who are obese have problems with ovulation. Right? They have anovulatory cycles. And in fact, obesity itself even prevents pregnancy. Right? Because of that. The hormones are messed up completely because of the obesity. The advantage of doing the surgery is that your reproductive system is now reset, comes back to the way it's supposed to be, because your hormones have changed, and the ovaries are secreting the hormones the way they're supposed to secrete. So actually, that improves the chance of obesity surgery improves the chance of you getting pregnant. It doesn't reduce the chance of getting pregnant. One thing is that if you want to take oral contraceptives, if you want to take any contraceptives, it's advisable to take oral contraceptives than the injectable contraceptives for the purposes of obesity surgery. But that is maybe another discussion.
All right. I'm seeing we've taken 9 minutes of your time, so we'll just ask a few more questions and we'll proceed from there. So, Janet has asked, after the weight loss, what do you do with the loose skin in your arms and legs?
So if you have excessive weight, let's say you are about 150, 160 kilos, and maybe you are a short person, that tends to happen after bariatric surgery, that you end up having loose skin because the skin has been stretched throughout your life during the obesity period. When you lose weight, you end up having skin that is very loose. We involve a plastic surgery, and we do a bit of plastic surgical procedures to try and reduce that. But that normally happens maybe around 5 to 10% of patients. 95% of the time, you really don't need that. Because what happens is that you lose fat slowly over time, and the skin also shrinks over time. Unless maybe you are very, very obese, you are 180 kilos, 170 kilos. That's when now you end up having excess skin because you've lost the fat. And we don't do anything until about 1.5 to 2 years after the surgery. We make sure that you've attained the goal of weight loss. Then we will do a plastic surgical procedure to try and reduce that fat and make you look lean.
So I guess this will be the last question. Rawira has asked, can this procedure be covered by my insurance?
Unfortunately, that is one of the challenges we have right now. We do not have insurance covering bariatric surgery. And this is many places in the world. That's the same case because unfortunately, many insurance companies still consider bariatric surgery as a cosmetic procedure. They feel that obese people are not sick people. They're just people like us who are just, and they think that maybe because people are eating too much, they don't know how to exercise, they're lazy people. That's the feeling that people get, which is wrong, completely wrong. And the insurances haven't really covered obesity because of that. Right? They feel that having an obesity surgery, bariatric surgery, is a cosmetic surgery. You're trying to look good. But in the Western world, it is covered by insurance. The reason being, if I was an insurance company and I have an obese individual, if that individual gets heart attack, gets a stroke, gets liver disease, diabetes, and all that, it is more costly to me as an insurance company because I will end up paying the bills for this person. If he gets a heart attack, he might need to go to the cath lab, he might need to have surgery for the heart attack, which is much more expensive over the long term. Osteoarthritis, he might need a knee replacement for his joint because of the damage to the joint from the obesity. So in the Western world, they realize that it actually doesn't make sense not to cover obesity because if you don't cover obesity, you'll end up with these chronic illnesses. Unfortunately, in our country, our insurance system hasn't really caught up with that. So at the moment, the insurance companies do not cover. But there is advocacy that's going on. There are people are talking at a higher level to, and especially when the WHO named obesity as a disease, then we're hoping that in the near future we have insurance companies covering because it makes sense for the insurance company. They will reduce the chances of these individuals becoming much sicker with chronic comorbid illnesses. Even COVID-19, as I mentioned in the beginning, if you have obesity, the chance of dying from COVID-19 is very high. The chance of going to the ICU from COVID-19 is very high, right? Compared to somebody who is not obese. And if the insurance is going to cover those costs, that's extremely costly. But if they cover bariatric surgery, then it reduces the chances of getting all these complications.
Thank you, Doctor. I'm seeing on the extreme right is a very nice poster talking about weight loss camp. Maybe I can invite the panelists to briefly talk about it so that the audience know what the word weight loss camp is all about.
So during the weight loss camp, we do a bit of nutritional screening, blood pressure screening. We take your height, weight, we assess you, then you have some few minutes consultation with the doctor. The doctor will discuss with you, we see your target, if you qualify for the bariatric surgery, or if we can put you in a nutritional program for a certain period. And then during that camp also, we will discuss about the costing and then how the date that you are supposed to come for the bariatric surgery. At the same time, we discuss about the program, the pre and the post-operative nutritional management, and how long that we are going to monitor your progress after the surgery. So basically, we'll be doing it here in the hospital, and we want to understand more and where we are able to answer all the questions, the worries and the anxiety that you have, and then we plan for the day.
So this is going to be on the 21st of August, not this weekend, but the other weekend. We will have a team of doctors, myself, my colleague Dr. Ramadan, Philip, we'll have the physiotherapy people as well, we'll have a psychologist there as well. And the aim of that time is to be able to understand your concerns, find out why you're having challenges in losing weight, and assess your BMI, first of all. Right? Somebody asked, what is BMI? So we'll be able to assess your BMI, tell you what your BMI is, and find out if you have other comorbid conditions associated with obesity, and then give you the best way forward. And introduce you to our program, our weight loss program. Unfortunately, we've seen, the reason why we come up with this is that we've seen quite a number of individuals who are obese, who have traveled to India, other places, they go have an operation done, they come back, and they don't have any follow-up whatsoever. And they end up with complications, right? They don't have any nutritional follow-up. Some of them, they gain their weight back, and they come back to us again. And we don't think that's the right thing to do. You need to have a proper program, which includes all the facets, and you have to have a proper follow-up. So we're introducing our program on the 21st of August at Abdi Hakin Hospital, and you will meet all of us. It will be a one-on-one discussion. You can come with all your questions, and hopefully we'll be able to assist you in your journey to weight loss.
Thank you, Dr. I'd like to just remind our audience, again, as the good doctor said, the date is on 21st August, time from 9 a.m. to 2 p.m. The venue is the main hospital, and also COVID-19 protocols will be observed. You can call us on 041 50 51 000 to book a slot. So I've seen Isaac has one last question. So can I ask the panelists if we can, specifically Philip, if we can ask the question? I know we have exceeded by about 16 minutes. So Isaac has asked, hello Philip, please elaborate whether rationing your meal quantities and frequencies is ideal for weight loss and control, like having 2 meals a day in reduced portion, just to cut back on weight.
To certain people it works, to certain people it doesn't work. Rationing requires a lot of discipline. And it's not about the portioning of food, it's about the calories of food. I'll give an example. In the advertisement right now, we are being encouraged to take like brown rice. 100 grams of brown rice will give you around 216 kilocalories. And white rice will give you 206 kilocalories. Now, when you ration brown rice versus white rice, you still, more, as the advertisement will tell you, go more of brown rice. The importance of brown rice, it will give you more fiber, but the calories are a bit higher. I think personal, individualized care, when you understand where you're coming from, will help us to understand whether rationing is okay for you or we tweak part of your meal program. Then when you talk about reducing the feeding time, when you keep on snacking, like you take a meal after every 4 hours or after every 3 minutes, after every 3 hours, we have what we call, there's an increased fat storage period. The longer the meal time, the higher the fat burning. The shorter the meal time, the higher the fat storage. So we check about how frequent you take a particular meal. So let's say if you take breakfast and lunch and dinner, most people, if they control their portion, they are able to reduce their weight. But if you keep on taking meals after every 4 hours, you don't give room your body to burn whatever that you've already taken. So we not only look at the frequency, the rationing, we look also at the activity level and your health status and age at the same time with compliance.
Thank you, Philip. So, Philip, somebody wants to see you. Where do they come?
So if my clinics are here at Aga Khan Main Hospital, Mombasa, from Monday to Friday, from 8 to 5, you see the receptionist, we take most of the insurance, they cover for nutritional counseling. At the same time, we have a good machine, what we call body composition analysis machine, whereby apart from the BMI, we are able to calculate your metabolic age. I can be 36 years old, but my metabolic age is 70 or 60. So this is a small machine to help us to get even your visceral fat, the muscle mass, your bone density during the clinic nutrition consultation. You're most welcome.
Thank you. Audience, now you know how you can get in touch with Philip. Dr. Abdi, if I'm interested in your services, how do I see you?
So I have a clinic here at Aga Khan Hospital. I'm here every Monday afternoon, Wednesday afternoon, and Friday morning. So you can call the hospital, make an appointment, and you will be able to see me. And then my colleague, Dr. Omar, also.
We are very lucky to have with us Dr. Omar here. We just ambushed him, as you can see. So Dr. Omar, if somebody wants to get in touch with you, how do they come and see you in regards to bariatric surgery and other services?
Right, so I run a clinic here in Aga Khan Hospital on Tuesday afternoon, Wednesday afternoon, and Saturday morning.
Thank you. So to our audience, we thank you so much for attending the session. As you can see, we also have a weight loss camp that is coming up, and I believe that is next Saturday, on the 21st. Please share it to as many people as possible so that they can be assisted. It's free. There's nothing that will cost anything on that particular camp. Please share it as widely within your network and assist as many people as possible. Also, stay tuned to our Facebook Live programs. We have them every 2 weeks, and we look forward to hosting you during our next Facebook Live session. Thank you, Dr. Ari, for coming. Thank you, Philip, for coming. Thank you, Dr. Omar, for coming. Asanteni sana.
Thank you. Thank you very much.
Welcome to the Dental and Implant Center. The Aga Khan Hospital, Mombasa is happy to announce the opening of its state-of-the-art Dental and Implant Center located on Buyuni Road opposite the YMCA. The Dental and Implant Center is designed to provide an excellent ambience with clinics that are well away from the reception area as well as from each other, thus providing maximum cross-infection prevention, especially during this COVID pandemic environment. This facility is designed to provide the most comprehensive dental service to our esteemed clients, from basic diagnostic services to the most advanced cosmetic, prosthodontic, and surgical procedures. Our dental specialists, general dental practitioners, and dental assistants are trained to provide absolute safe dental treatment using the most up-to-date personal protective equipment and additional oral aerosol suction units with HEPA filters to minimize the spread of the COVID virus. This is keeping in line with international and Kenyan recommendations from medical and dental associations. Our goal is to provide safe, compassionate, affordable and quality dental care in a friendly, modern environment. Our patients can expect a personal, caring attitude, a supportive team approach with an accessible and efficient service through modern techniques achieved through continuous professional development of all our dentists and staff. We look forward to receiving our clients for all their dental requirements.
Welcome to the Aga Khan Eye Care Center. My name is Dr. Sofia Asaria Banji, and I'm the lead optometrist. Here at the Aga Khan Eye Care Center, we provide comprehensive eye exams. We also provide optical services, such as glasses and contact lenses. Our exams are complete comprehensive exams. What does that mean? That means when you come in to see us, we do a comprehensive, full evaluation of the eye. We take a look right inside the eye, we see the optic nerve, we check your lens of the eye, and we look directly in the back of the eye as well. We check your optic nerve and your complete retina. We also check your eye pressure, and we're able to diagnose diabetes, high blood pressure, and even see if you've got cataracts. Our hours are Monday to Friday, 8:30 to 5:30, and on Saturdays we are open from 8:30 till 1:30. We are one of the few facilities in Mombasa that provides this care, so we welcome you to come and see us.